Do you think that it's going to be possible to put these candidates up for election?
There's certainly a huge amount of interest. When I put a letter together that was published in the Sunday Independent recently, I was really surprised, happily surprised by the overwhelming support I got for that. So I got, within 24 hours, 250 fairly high-profile signatures to really support that, with a number actually wanting to put their names forward to challenge at the next election. So a huge amount of enthusiasm, a lot of backing. And since that letter, that's come from right across the public, not just within the profession. So I really think there's a drive, to push this forward, and we hope to do that.
Some people might criticise you for this action, saying that you're really just angry that you've been defeated by government, it's law, and you're just throwing your toys out of the pram.
Sure, I mean, that's understandable. But we weren't defeated, actually. We won all the arguments, really. And actually, a lot of those arguments were put forward in internationally peer-reviewed journals. They weren't riposted by the political leaders. They haven't responded well to the fact that the NHS founding principles are going to be undermined, and this will lead to increasing privatisation. We won those arguments. The public believed us. What we lost to the parliamentary maths. And that is why we need a political party, because the coalition has shown that they can trample all over the democratic process, because they control both houses. The House of Lords, because of the Liberal Democrats, I think has failed in terms of assessing this legislation properly. And we have a situation where the executive has got complete control over both houses. They've got control over the legislature, and I think that's really dangerous. And what this party can do is to counteract that. I think it'd be very powerful if we get a few MPs.
Now, you've aligned yourself very closely to Bevan, but how realistic in this day and age is that? And times have moved on, the NHS has moved on. Is that a sensible way to present yourselves?
Well, I think we've aligned ourselves to Bevan's principles regarding the NHS, which was a publicly provided, publicly funded and accountable system. And we believe that's the most cost-efficient and cost-effective way to deliver healthcare, and we believe the evidence supports that. We still only spend about 8.5% of our GDP on healthcare. We've got a very cost-effective service. The Commonwealth Fund shows it's performing extremely well. So the government just didn't put the case forward for such radical reform. And we strongly believe that the founding principles of the NHS are the right principles for a fairer and more cost-effective and more equitable healthcare system.
But is it really true that we're going to become consumers of health in this new landscape?
Well, that's the whole aim of a market-driven system. You turn citizens into consumers. The market can't function without the choice mandate, and that's why choice is almost being forced on to patients. Most patients don't actually want choice. When you feel poorly and unwell, you want to be close to your relatives, you want to be close to your support networks, and you want to have a good local hospital. And that's what the evidence points towards. So I think the drive towards consumerism will actually drive up costs as well. So I don't think it's helpful in any respect.
What about your continued campaign? Do you think that the public will get compassion fatigue? Because they think rather than arguing with the government, you should actually just get on and run the hospitals.
Yeah, I mean, the problem with engaging and pushing forward the privatisation process is it will just increase healthcare expenditure. Obviously, we will, as doctors and healthcare professionals, put patients first always, and we will work our hardest to make sure patients get good care. But that still doesn't stop us from opposing these reforms and trying to get some of the Act repealed, if not all of the Act repealed, because we believe that patient care will be harmed, and our first duty is to look after patient care. So that means trying to reverse a lot of these changes.